Stein, one of the deputy editors for the American Journal of Psychiatry, and I'm thrilled to introduce some wonderful new papers for the October issue. So we know that rates of cannabis use disorder are relatively high in the United States. However, there have been a number of events over the last 10 to 15 years that have raised questions about whether or not these rates might be rising. This includes changes in the laws regulating the distribution of cannabis, as well as changes in the public's view of cannabis. Hasin and colleagues report important new data that examine changes in the rates of cannabis use disorder during this time period between the end of the 2010 era all the way through 2019. And the important new findings suggest that there has been a steady rise in rates of cannabis use disorder. And this is important because it raises questions about the relationship between some of these changes in policy, rates of disorder, but also because for clinicians, they need to pay attention to the fact that these rates are in fact rising. Mindfulness-based psychotherapies hold great promise for a range of conditions, but there's two sets of questions that exist. The question examined in a new study examines the degree to which mindfulness-based psychotherapy changes aspects of brain function. A second question that's not examined here is exactly what kind of conditions mindfulness-based therapy might be helpful. The new findings use brain imaging to examine effects on the neural correlates of pain processing. And the findings extend a wealth of research that defines these neural correlates with a high degree of clarity. The important new findings suggest that mindfulness might have unique properties to change the neural correlates of pain-related processes as compared to a control therapy that's examined in the study. And this is going to generate interest in thinking about how we can use this therapy clinically, particularly to target problems associated with pain, but also the other range of problems for which mindfulness might be helpful.